Careful. Hello, hello, hello. Welcome to Moving People to Action. My name is Tim Clark, the founder of this social media platform that our goal is to create opportunities to have meaningful conversations that will lead to empowering people to make informed decisions, MP to action. We have a great panelist for you tonight. Focus will be really on the impact of mental and behavioral health, really largely caused by what is happening here in this environment, and particularly COVID-19. But I want to bring on our co-host tonight, actually our facilitator, host tonight. I'm kind of doing the Russell Simmons kind of thing. I'm going to introduce and I'm going to get out of the way. But Larry Duncan has been really part of this community for many years, over 20 plus years, a military guy, and really has committed a lifetime of really studying and focusing on behavioral health, mental and behavioral health. He serves as the director behavioral health for Charles Drew Health Center here in this great city, Omaha, Nebraska. And so with that, I would like to bring on Larry. I want to thank him. Larry, first of all, thank you, man, for taking the time.
Yeah, I appreciate it, brother. Appreciate this is a request that I get pretty often, and very rarely say no to speaking on the subject.
So let's just a little bit before we bring Brother Heem on to set the stage, but just in terms of your role that you're functioning in right now, let's talk about that a little bit in terms of just what is your role and responsibility at Charles Drew Community Health Center?
Yeah, I'm the senior director here at Charles Drew. Matter of fact, I'm in the building right now, and this is my office, and so I'm over the behavioral health department, and so that's a whole entire portfolio of services that we provide to the community, primarily North and Northeast Omaha, in the three primary zip codes that surround Charles Drew here on 30th and Grant. So we provide behavioral health services, individual counseling, group counseling, education, psychosocial education for adults, for youth. We are positioned in school-based health centers. So we actually have therapists in high school, West High School. We have therapists in King Elementary. We have therapists in Belvedere, and see where else we have therapists. I'm leaving the school out. So, but in general, we are in the school-based with therapists. We also are at the county jail. We provide evaluations and assessments in the county jail at Douglas County Jail. In addition to that, we're at DCYC, and we are providing therapeutic services to the youth and DCYC for a long period of time. It could be said that there was no therapy for the kids, babies, while they were in detention. Well, that is no longer the case. As of last year, we've been providing services and assessment services for them also. So we have a team of 14 therapists. So it's a combination of mental health therapists and drug and alcohol therapists and individuals who have a combination of the two. So those are the services that we provide. From my standpoint, it takes a lot of administration to execute all that. So from my standpoint, I'm the person that's behind the scenes doing all the administration that causes all that to happen. I also work with a great partner a man by the name of Ted Lampkin. Actually, we have worked together for a long period of time. And
Okay.
so we were in private practice together. And then so here he is associate director along with me. So I do have a great deal of help. He oversees the day-to-day operations. We both still see clients.
Okay.
Not a lot of them,
Okay.
but we both still see clients. And so from a standpoint of
Well, it sounds like you're extremely busy.
to say the least, but I love it. I wouldn't have it any other way.
Well, that's awesome.
Yeah.
Well, that's good, man. Well, hey, I'm going to get out of your way. I just wanted to just have some dialogue with you, but really would like for you to take it from here. And again, thank you. This is a very meaningful conversation that we must have, especially as Black men, and even I think, you know, in terms of just myself and the mental aspect of just the need of to stop, pause, and really raise your hand and say, hey, I need help. I need to talk to someone. And so, well, I have a few questions on the back end. I'm doing the kind of the Larry, the Russell Simmons. So I'll come back and help you wrap it up, man. But I'm going to go ahead and let you do your thing, and we'll go from there. Okay, I'll see you on the backside.
Okay. Well, thank you. Thanks again, Tim Clark. And so at this point, that's what we want to do. We want to address the whole issue of mental health in our community in particular. And we have two great panelists on tonight. And so at this point, we're going to bring up Mr. Raheem Sanders, and he's going to do introductions from there.
All right, what's going on, my good man? What's going on, good people? How y'all doing today?
I'm good.
All right. So tonight we got an interesting topic. So, you know, what's the question to set it off?
Well, I would say, you know, in general, when we're talking about mental health, we take for granted that what mental health is, what that really means. It's two words that covers a whole lot of different things. So I think tonight we'll be able to really dig into that and get a real full understanding of what mental health is all about. But just to start it off, what would you say is the state of mental health right now? How would you speak to the whole issue of what is the state of mental health right now?
All right, that's actually a really good question. Before I jump into the state of mental health, I do want to address, at least from a data perspective, of what mental health is. We're going to have a lot of, you know, good professionals on, including yourself, my good man. But just for people to know exactly what mental health is, mental health, especially a mental health crisis, is a crisis situation that exists anytime where, you know, someone feels no longer safe with themselves or with others and is in need for immediate action, for intervention. Signs of what a mental health crisis look like usually consist of rapid mood swings, extreme energy or lack of, you know, a lot of sleeping or the inability to sleep, a lot of agitation, a lot of confused thinking and irrational thoughts, thinking people are out to get them. It's a really a sense of endangerment and threats that one feels for himself. So then there's a perception of these threats in their environment. So a lot of hallucinations and delusions, making threats to others or themselves, isolating themselves from people that they love, not eating or taking care of themselves. And at the end, like a lot of people talk about, you know, suicidal thoughts. So that's kind of what a mental health crisis is. So in terms of the state of mental health, statistically, 1 in 4 people are afflicted by mental health illness at some point in their lives, and women are twice as likely as men to be diagnosed with a mental health illness. Since the beginning of this year, 40% of adults have experienced some symptoms of mental health, some symptoms of depression or anxiety, all right, especially during the COVID-19 epidemic. I think from the statistics, 3 times as more of adults experience these symptoms than they would post or pre the COVID pandemic. So that means the mental health crisis have impacted a lot of adults in our country and around the world. But we just stated some statistics about, adults and what that may seem like. But you have to also remember that children also have mental health illnesses as well. But before I get into the children, I want to make sure that we also state the fact that 2/3 of people with mental health conditions don't receive the care that they need. So they may be going through all of these feelings and experiencing all of these things, but they are not receiving the care. Like if I had, let's say, COVID, I would go to my doctor and he'll get me straight. But with mental health, a lot of people aren't turning to proper care to get this resolved. And then what happens is that people with serious mental health illnesses are twice as likely to develop cardiovascular and metabolic diseases. The way that you feel about yourself impacts the way that your body operates within yourself. Don't have all the statistics, but people with depression have 40% higher risk of developing different, cardiovascular and metabolic diseases. And it can range from a lot of the things that's, going on within your environment. As we mentioned with depression has been a hot topic, but I think by the data, over 30 million people across the world has experienced some type of depression within, their lifetime, especially during the COVID epidemic. And if you can at least imagine what that impact would have on someone's life if they've experienced it for a long point in time, now we're talking about a mental health illness that has, transformed itself into a chronic disease. So let's go back for a second. We talked about how mental health is impacting the adults, but there's no child health without the adult caregiver health. So if the adult caregiver is experiencing mental health,
right, exactly.
How do you expect that child to be impacted? I believe from the data, 40% of parents reported that their child has new or worsening mental health conditions since the beginning of the pandemic. And a little bit over 30% of the parents that has reported these illnesses with their child, they were also reported trying to seek help for their children with a mental health provider. And that's important because if majority is hard for parents to find help, and it's hard for parents to find help for their children, I would also like to transition to people of color, because generally I was just talking about ordinary people, but now
you're talking about mental health as a whole, right?
Indeed. But now that you put a label to it or a classification to it, let's just put a skin color to it.
Okay. All right.
COVID has brought a wave of mental health, a lot of anxiety, stress, fear, economic instability, isolation all across the country. Right. But we haven't focused on that impact on people of color during the COVID epidemic. We just came up on 1 year of George Floyd, right? So as people of color, seeing those type of images on TV, not just George Floyd, but all of the other police killings and shootings, the images of Black people shot and killed by police, the mass protests, and especially the shock of the Capitol riot has opened up a deep wound of racism within the American culture. And based on the data, there's racial disparities within the mental health services that are provided to people of color. If we look at the data, 86% of mental health practitioners, psychologists are white. So that leaves less than 2% are African American. So
Mhm.
if we have this large African American culture being impacted not only by COVID, not only by mental health, but the racial disparities and the impact that comes along with it, is really hard for people of color to not only find people that can relate to them,
Mhm.
but can seek mental health services that are appropriate, that can provide them with the care that they need. So in terms of the state of mental health, to be quite honest, usually I'm in a happy mood, but we're in a pretty bad state.
Mm.
People are hurting everywhere, especially people of color.
Mhm. But you've downloaded quite a bit of information with that, and that's going to set the stage very well for our
That's
conversation
what we do.
tonight. I know we're approaching a break here pretty shortly, but as we go into the
Mhm.
break, what kinds of things would you say that are in the environment that we have in our favor? So you painted a picture of mental health in general, as far as how it's affecting the country and how it's affecting the people really globally. And then you drill down some in regards to how it's affecting people of color. And we hope to talk about that a little bit more with the panelists that we have coming on. So I think that's a good setup for our conversation for the night. But yes, if you could leave it with one thing before we go into the break, what in our environment do we have in our favor? What's working for us that's going to help us move forward?
All right. So to keep it brief, to be honest with you, like I mentioned, the mental health pandemic that we are experiencing is a great one, not only for people at large, but especially for people of color. But what we do have in our environment in this moment in 2021 is that we have three things that can help us out. We have one, that there's a focus on mental health. Traditionally, we didn't talk about it, but now we are. So now we have that focus. The second one that we have is empathy, all right? People, now that they know it's an issue, they feel some type of way about it. So I think that's something in our favor, especially in people of color and what we've been dealing with. And the last thing I think we have in our environment, we're in a modern century. So what we have most is the creativity. We got the technology, we got the resources.
Okay.
Based on what they've been passing out with these stimulus checks, we got the funds. So what are we going to do about it?
That's a good way to put it. That's a good way to leave it as we go into the break. There are some unique things that we're facing as a people, Black people, people of color, and there's some unique things that we're facing as a country in relates to mental health. It is encouraging to see that some of the initiatives from the federal government in particular is investing in addressing some of these concerns. And we will surely pick it up from here after the commercial break and drill down further. All right, we'll be glad to do it.
All right, see you soon.
All righty. We're going to commercial.
Hi, my name is Danette Smith, CEO of DHHS, and I am going to take the COVID-19 vaccine because I'm Big Red responsible. I wear my mask, schedule my flu shot, answer my phone if called by contact tracers, and I avoid the 3 C's: crowded places, close contact, and confined spaces. Please protect yourself and your community. For more information on COVID-19, visit dhhs.ne.gov.
we're back. We're back, and there's nothing like a short commercial. It's one of the things that anybody that's watching video content with me will tell you. I don't like long commercials. So we appreciate that. Now we're going to bring up our panelists. You have seen their bios. We're working in a multifaceted environment here. So some of the things you see, I can't see. Some of the things I see, you can't see. But my understanding is that you have seen the bios. And so I will introduce our panelists and let them speak some more specifically about themselves, because I don't have their bios in front of me. The first panelist that I will bring up would be Ms. Sherry Dawson. And she is in a very prominent position in the government related to mental health and mental health issues. I'll let her talk more specifically about that. And then Elisa Farmer, her name always rings in a way that makes me want to mispronounce it. So I will bring her up. Also, we have been operating in the community in a similar fashion. Actually, attended the same school to some extent and has operated in the same field. So we've never worked together, Elisa, but I have seen her work and heard of her work and met her when she was in the developmental stages of what she is now doing to the max. So she told me a long time ago that she was going to be doing these things, and now here she is. So Ms. Dawson, if you could, I know you was telling us that it could be potentially a issue with the lights going out in your building. So I see that you have already entered into the darkness. I'm in my work building also, and I'm hoping that no lights go off, because if the lights go off in here, it's going to be a problem. So I know that you are in a executive position with Department of Health and Human Services.
Yes.
And if you would tell us exactly what it is that you do and give us an introduction of yourself, I'd appreciate it.
You bet. Thank you. Thank you, Larry. And to just the planning committee for this opportunity. My name is Sherry Dawson, and I happen to be a registered nurse by training for 39 years. So healthcare is very near and dear to me. When I was a child in elementary school, I was a child that experienced stomach aches and was afraid of crowds, didn't want to go to school. And so at a very early age, I had life experience with anxiety and depression. And I will say ever since that time, it's probably been between nursing and my lived experience, a calling. So I serve as the director of the Division of Behavioral Health here in the Department of Health and Human Services. Many in the area may know that our division works with our system partners. We have 6 behavioral health regions across the state. Region 6 is in that community. And our funding is really intended to meet individuals that fall in between Medicaid eligibility and people that don't have insurance.
Yeah.
And so I want to start the message, Larry, with I believe there is no health without behavioral health. And I think these forums help all of us in healthcare because behavioral health should be a strong part of that. And we have to acknowledge and just start the conversation by acknowledging the inequities that we experience. That individuals that are Black in our society experience racism. And unless and until our system continues to work together to identify, to address and acknowledge racism and inequities and the trauma and how people experience that, we will not be as far along as we need to be as partners.
I would agree. I would agree. Thank you so much for that introduction. Elisa,
Yes.
feel free to introduce yourself.
Yes. So I am Elisa Palmer, and I am a therapist over at Heartland Family Services. And Heartland Family Services offers an array of behavioral health services, very similar to those that you've talked about that Charles Drew do. We're a community partner. My specific role is I am an in-home therapist. And so that's a little different than many of the therapists right now. For the last 3 years, I've been in the in-home program, specifically going into home, providing therapeutic services to families in crisis and their children, doing evaluations, referrals, and some of the clients retaining for myself. Majority of the clients that I do see are North and South Omaha populations, below the poverty guideline, or living in subsidized housing, low income housing. So when you see me, I'm going to be looking like this, very casual. I don't have no nice office. I do get some clients in office, but 90% of my job is in the field, even during COVID.
Right.
Outside of family and children, I also get to see some with disabilities, but I see my population is majority African American or people of color.
Okay. Well, that's when I came to Omaha, and then I started in the field. That's how I started. I started as an in-home therapist, and early 2000s. I was with Dr. White, and so some of the people out in the community who are listening to us tonight will remember Dr. White. He was one of the first individuals who developed the whole idea of in-home therapy, and there's some reasons for that, as far as why that was a approach that was necessary and vital in our communities. Okay, so let's just get started. Mr. Saunders gave a real good idea of, some of the issues with mental health. He gave it from a broad standpoint, gave the big global picture, then he drilled down some in terms of people of color, Black people in the local area. So is there anything that you would like to add, or anything that was particularly highlighted for you, and anything that he shared? So just to kind of connect with what he said, is there anything that you'd like to say in combination with him, maybe to further what he said, or to just pick up from there? Feel free to speak for you. Everybody's unmuted, so just whoever speaks, somebody else can speak second.
You want to go first, or I can go? I'll jump in. I'm a talker, so you give me a church finger and I'll stop.
Okay.
Go. But I will say that when we talk about people of color and people in our community, he was right. There is a lack of individuals that seek our services. And I would like to highlight and speak specifically to our African American men in our community, that they just don't, they're very reluctant to receive the services. We don't have a lot of therapists in our community that look like us, and the ones that we do have that look like us, they are just swamped. I mean, we have more clients than we have therapists that are available. And then if he talked about psychiatrists in the communities and in our community of Nebraska, just to get into any psychiatrist is a 90-day wait at a minimum. So you add on top of that they may want to talk to someone that looks like them. They could work for 6 months to a year for a wait to get a psychiatrist that looks. So I just want to highlight that, because I want to make sure we speak specifically in regards to our community and some of the barriers that lie in front of us. I can go in a home, but if I don't have nowhere to send somebody for someone that looks like us, then I'm having a hard time, more clients than I could ever see.
So the barrier of resources is a major barrier. From what I hear you saying. Then when you look at all of the various dynamics that go along with that, folks who are trained, people who are providing services, people, whatever stigma or thoughts about that is in the background, all those things only compound it and make it worse. Sherry, did you want to add anything to the initial introduction thoughts?
I would just add, totally agree. with the workforce in general. That is, as she pointed out, short in general. And then if we do look at having individuals that are look like us, understand our culture, and even those that are trained and in the workforce right now, there are providers that do an excellent job of understanding trauma and putting out on the table and asking to build that trust and take that time to establish that relationship, which is challenging for anyone in behavioral health. And then, as Alicia pointed out, within the Black community. And so if they go to a therapist that perhaps is more about getting the diagnosis and treatment, that leaves a lot out, right, for that opportunity to build that trust and relationship. Raheem talked just a little bit about adverse experiences and youth and children. And I think that is a really important concept, the adverse child experiences.
Yes.
And we know the variables of adverse events. And the more of the experiences and events that children experience, we know as adults, depending upon how that is addressed or not addressed, is going to, they're going to be at high risk for both physical and behavioral health, which brings us back to the continuum and that opportunity to get into the prevention and early intervention and in the home that you talked about.
And the term ACEs is a very good acronym for the work that's done in that area. So when we break it down and just look at it real simply, that we can assess the type of events, the issues, the problems, the trauma. I think about trauma, I try to frame it in a way that the audience can understand it. Things happening to kids physically, psychologically, emotionally that they're not equipped to handle. They're too young. They're not developed enough. It's over. And so therefore it's too much for them. Those kinds of experiences, the more that they have, the earlier that they have them, and the combination of them, we can assess that early, and it will speak to the conditions they will have later, medical conditions they will have later, and specifically psychological, psychiatric issues that they will have later in life. So that's pretty major. All right. So when we talk about mental health, we know that mental health in general, and I'll put it like this: when an individual has, to some extent, lost control of their mind. So they're hearing things, seeing things, they're under mental distress. And so some of the things that are more, I would say, severe and persistent, to use the exact terminology, we clearly understand what that is. We know what that looks like when we see it. We know what that sounds like when it's speaking. So we know what that is in general. When you, from your experience and working in the field of mental health, what type of unique things are unique to Elisa, people of color related to mental health that perhaps goes beyond the things that we traditionally think of that I just mentioned in terms of a more extreme example? So when you talk about someone in the street, walking down the street, talking to themselves and all those kinds of things, well, yes, we all know what that is. We don't really need to have a conference to know that there's something really mentally wrong with that person. But is that all of what mental health is?
Of course not.
Is that so? When we give those descriptions, we just okay, that's what it is. Then we might as well just wrap it up and pull down the shades, because I think everybody know that. So how can we dig deeper into what mental health is from your perspective? How do you see what is mental health, and what are the issues mental health related that affect people of color, Elisa?
Ooh, that's a fully loaded question. I'm laughing out loud.
That's what we do.
Let me put my coffee cup down. You know, the stigma around, first of all, let's talk about just the stigma around mental health for people of color is from generations. You know, it wasn't that African Americans didn't want help or didn't have mental health problems.
Okay.
It was more, you know, if we could go back to slavery, we were conditioned not to ask for help. We were conditioned to be quiet, not to talk about those things. We were conditioned to always be strong and walk around with our S on our chest. So we have that image that we are strong, we are resilient. So for us the stigma is for us to seek mental health services, it makes us look weak. And so when we are having that life-changing situations, as I do trauma-informed care, the trauma, I call them life-changing situations. That death in the family, that we lose someone to gun violence in our community, or so we've lost someone unexpectedly to COVID, these life-changing situations that may go on. We don't get that, our first avenue is, go talk to someone that is trained and has been trained to deal with individuals that's going through grief. Our first stop normally in an African-American family is to go to our churches and our spiritual sources. And not taking anything from a pastor or a church or any religious organization. Yes, that is a great resource and a great support system when you're dealing with depression and anxiety symptoms. But when you have a disorder of anxiety and depression, and that means you have symptoms that happen on a frequency daily or nearly every day, or more than 14 days out of 30 days in a month, then those are having times where you need to seek a healthcare professional that happens to be credentialed in mental health. Can even make a referral to you for a psychiatrist that can prescribe you some medications to assist in those areas. And so that's a long process that African Americans oftentimes don't even have the time for. You know, African Americans in our community, and we're gonna talk just about our people of color right now, that's my focus, but they're working 2 or 3 jobs to maintain a family. They have they have 2 or 3 children in the home. To get these services and these appointments scheduled, it's Monday through Friday, 9 to 4. 4 o'clock, probably the latest time you're gonna get a therapist appointment in our community, and these individuals are working. So to just reiterate that these are things, it is some systematic racism things that fall into place that lead to barriers why African Americans are not seeking those services. You know, we can talk about just in our school system and the services being available. And it's great that there are therapists that are in these schools now that Charles Drew is having available. But when we talk about the student to therapist ratio and the availability, if you have a central high school that has 1,000 students and 10% of them need to see a therapist, that's just hypothetically speaking, 10% need to see a therapist, but we are one therapist or maybe 2 therapists that fills one 40-hour-a-week role. How many students can they see in that time? I just, I like to put numbers and make it realistic. And that's the thing they talk about, that schools are the first, outside of the home, the school is probably the first place that someone's going to get those, that even the light shined on them, that a therapeutic service is needed either for that child, that parent, or that family as a whole. That's where most of my cases come from.
Yes. The overall information says that in terms of mental health issues as a whole, mental health issues are occurring for the American population about at the same percentage. So we're not having more, we're not having less, they're somewhere within the same percentage. However, how we are accessing as Black people, how we're accessing that care and the chronic nature of some of the things that we deal with, it's different in that respect. I think, Jerry, you are in a unique position from the standpoint that as a nurse, you've worked with people and, as I would say, on the front lines. And then as a executive, if I could use that word, you're seeing the bigger picture. And as far as I can see, it's a little dark, but as far as I can see, you seem to be of European descent, if I could put it that way. So I think all that gives you a unique perspective to say to us, how do you see the issues when you look at from your whatever your experience has been and how you how you positioned now? How do you see issues in our community as different from the population as a whole, or do you see it different? And I want you to feel free to answer that and as genuine as you can, because it's an opportunity for us to get your perspective on it, as well as to give you our perspective.
Yes, and Larry, thank you. And I hope that it's the latter, because I certainly will share my perspective, experiences, and information. But I'm also here to learn and to be able to get us to act. Raheem. So I will look forward to that. I would just say again, if we think about recovery just across anyone that's experiencing a mental health or substance use disorder, there are tenets to recovery. Home, having a stable place to live, your health, physical, behavioral health, community, that there's natural connections, relationships, and supports, and purpose, which could be education or a job. With COVID, what of those have been impacted? Absolutely all four of those.
Yes.
Sometimes people, we call those social determinants of health.
Yes.
So in order for you to be well or healthy, you have to have that full home health community purpose to help move the journey forward. I know in looking at the data for, Raheem talked about some in terms of access. I would say that the percentage that we have experienced in Nebraska looking at race is about 7% for young people with substance use.
Right.
11% for those 12 and over, and about 43% for adults and children with mental illness.
Wow.
We have disparities in the Black community. We have experienced, I will say, barriers, natural barriers, because as Alicia pointed out, we also don't have access where it always should be, right? Yeah. So again, trying to think about those disparities, and I want to get to solutions in a way that we absolutely acknowledge workforce challenges and where we serve people. If faith communities are absolutely one of the strongest places that individuals in the Black community go, how can we think about our service location rather than being in a clinic, or to Alicia's credit, in the home? Where are people going? If they're going to the food pantry, if they're going to the job location, if they're going to church, if they're, we have absolutely got to make access easier. And part of that is listening and learning from you all about what that looks like, because place matters.
Absolutely.
It would not be the case that where you live determines how long you live.
We and Alicia can speak for herself. So just to summarize this up, because I think we're somewhere getting close to another commercial time, but you know, we believe that some of the barriers and limitation to disparities, to some extent, is intentional. That is kind of the definition of systemic racism and like that. So when you look at these are problems, and then we say, okay, yeah, these are problems. We can all see that these are problems. People are not getting access. The access is not really available, et cetera, et cetera. Let's work on that. And so we work on that. And then X amount of years later, the problems are still there. Then at some point, okay, this must be intentional. It's same way with some of the things having to do with policing, which is a whole nother topic for another day, is if we identify this is a problem, you're using excessive force, and then we put a lot of attention on it. There's a lot of outpouring and whatever, and then it's X amount of years later, it's still happening. Okay, then this is on purpose. So you look for the standpoint to speak to. I like you see, did you see how weave in the recovery model in there? Elisa, she weaved it all in. She had the whole wheel of recovery.
She did it. I like
She did that beautifully. So I like how you pointed that out. So we look at, for instance, schools.
Yep.
And the whole idea of purpose. Purpose saying that children need to have a sense of identity. They need to have a sense of who they are in the world. They need to have a sense of their worth and their value. And a primary place that they're going to get that, of course, is home. If the home is disrupted in any way, then the biggest backup to that is going to be school. So if in school, for instance, we understand that that's the biggest place where this information and build up and edification of youth is going to take place. This is who you are. This is where you're from. This is how you got here. This is what you got to deal with. You see what I mean? If they're going to get that, then it's going to have to be some history taught. There's going to have to be some critical, real history involved in school that's going to elevate their sense of esteem, elevate their sense of purpose, elevate the sense of who I am as a child, which will also, research has said that ethnic related background environments of education raises the scores and lowers unwanted behavior. So that's a protective factor. But it would take, you'd have to move a mountain and slay Goliath to get real, true African-American history. When I say the history and the connection of Africa and America in the school, so the kids will have some understanding of who they are prior to slavery, and slavery not even being dealt with in a real way, but that's not the beginning and end of who they are in the world. But that there is a great resistance to that. So that's intentional. So if there's disparities, and I think we have to continue to work on those disparities, then to some extent, the thought would be that's intentional. So what has improved? What has gotten better? So from my standpoint, definitely dealing with the funding and Region 6, as you mentioned, and the regions being brought down, there's no one that can come here to a federally qualified health center, which Charles Drew is, and be turned away from services. And that is greatly supported by the funds that come from the Department of Health and Human Services. That is consistent. It's not going up and down. It's not wavering. So we can say that people come here that don't have anything, they can still get services for themselves and for their children. Medicaid has been expanded. So, and we're seeing more people on the roads there. So the funding is improved. That's in a sense of improvement. There are they're in my ear, so I have to pause for a moment. The funding for to provide more therapists, that's increased too. There's programs that are available to train and treat other people. So briefly, give us a short idea of what you think is improved in regards to that, and what's working for our communities in regards to mental health. And then we'll go to break.
Go ahead, Ms. Sherry. I went first last time.
Okay. Well, I think one of the other things that has increased is the recognition of the whole continuum. So we got to get out front. It's great that, there are some services when people are experiencing crisis, but you talked about the young people, Larry, and having prevention, substance use prevention early, early on, thinking about early childhood and wellness and looking at some of the other activities that are more education based to help improve the health of individuals. I think since the time I have been a nurse, I can't even tell you that prevention was even taught when I was in nursing school. It was all about once you get to the point of
Right.
impairment.
Yes. Yes.
Stigma and awareness, I think, is the other thing. We're having this conversation tonight. As you pointed out earlier, opioid crisis,
Mhm.
COVID disparities. There are a number of things, unfortunately, bubbling up. And yet there is still a reduction in stigma. Again, if I look back over time, even my time here.
Yeah, I would agree.
It's
Lisa?
not where it needs to be, though.
Yes, there is a reduction, but there's still more more journey to go.
I would say for an area of improvement or that we're seeing movement in Nebraska, in our Omaha community, is that we have taken an approach of trauma focused and trauma care, which is very important, especially for our people of color. And people are being trained specifically to focus on that and be more empathetic. I think Rashid talked about that in the beginning, about being more empathetic as one of our benefits that we do have that's available along with that funding. But that trauma-informed focused care and trauma-informed focused cognitive behavioral therapeutic services that are available and coming more available now is important. We do have more of a presence of our African-American therapists and health professionals that are starting to say, hey, let's get this list together and let's share the wealth, because and I think that's a benefit that I've seen. Oftentimes you see like everyone was kind of like, I don't know no other African-American therapists, but now we are in positions where we are connecting the dots for the other individuals in our community. And if that's not my area of expertise,
Right.
I acknowledge that's not my area of expertise. And I'm sending them in the direction of other individuals that can help them. So I just want to say that, that trauma-informed focus, that trauma-focused care is very important in our people of color community, because it addresses those things of that gun violence that goes on in our community. It addresses in Nebraska that 3 degrees of separation, because not only is the gun violence happening to my son, but maybe it's his friend that happens to be his uncle's brother, cousin, and they know each other. They all go to school together, and the aunt work with the mama.
Only in Omaha.
Only,
I don't think so, but yeah, I bet it does.
Not only in Omaha, I mean, when we talk about, we talking about Omaha tonight. We talking about Nebraska. We talking about what needs to be done for people of color in our community right now.
Yeah.
And this is just the reality of it.
Yeah, I'm just talking about the closeness and how one person is
right.
related to another person
It
is related
is.
to another person. So they're in my ear. We got to go commercial. We have taken to, just for our audience tonight, we've given you a picture of what mental health is in general and specific to our communities. We talked about some of the disparities, most of which I'm sure you are aware of. When we come back, we want to dig more into this whole issue of trauma and what that's really all about. What are the differences in terms of trauma from community to community? Is it the same, or are there some unique things for people of color? So at this point, we will take a break.
Hi, my name is Danette Smith, CEO of DHHS, and I am going to take the COVID-19 vaccine because I'm Big Red responsible. I wear my mask, schedule my flu shot, answer my phone if called by contact tracers, and I avoid the 3 C's: crowded places, close contact, and confined spaces. Please protect yourself and your community. For more information on COVID-19, visit dhhs.ne.gov.
Wow, I love it. I'll tell you what, every program should have commercials so short as that. That's nothing like a short commercial. That's why streaming devices are so much in vogue. You could just fast forward right on through the commercials. But hey, people got to get paid. So advertisement must go on. Okay, so let's unpack this thing with trauma. You know, there's never enough time. We most people that work with people, we're people who love and work and support and are passionate about helping people. Most of us talk a lot. So that's a good thing that we are gifted in that way. So let's unpack trauma. Let's talk about trauma in general, and let's leave the audience with an understanding of the unique issues related to trauma with Black communities. So let's talk about trauma in general and all of that. And then let's talk about specifically how that is somehow different and the ways in which it's different for Black and Brown communities. So who would like to talk in general, talk about trauma? I think, Sherry, you started off and you talked about it from the standpoint of assessing it early with the ACEs and how that relates to determining how people are going to function and what their health, the quality of their lives are going to be mentally, physically, emotionally later on in life. Is there more that you can say about what trauma is in general?
Mhm. Well, I would just acknowledge that trauma is really about an adverse event, and that is individual. So I may experience something differently than you, Larry, and yet that can still be the trauma for me in terms of an adverse event. I think when we, the easiest way, just as a nurse, that I think about trauma is we know about the fight or flight response, and that's supposed to be a good thing to put us into a position. But it's really the harmfulness that comes. Imagine that your brain, when you experience that adverse event, turns bright and turns on. And imagine now I have experienced, I've lost my home. My parent has a job. My parent might have substance use. There's loss of people through incarceration, through COVID, those kinds of things. It's like that light continues to stay bright.
Yes.
And it stays on, and therefore it is going to impact not only my mental health or how my brain is working, but it is also going to begin to impact the physical system.
Awesome. So so now we say in the field, we are concerned about what's wrong with you, but we're more concerned about what has happened to you. What has happened to you? And that's really our focus. And it's not so much labeling, because the labels are good for education and billing and all those kinds of things. But in terms of real life dealing with people, what you have experienced, whether it's violence, whether it's abuse, whether it's verbal abuse of some kind, whether it's homelessness, whatever it may be that's overwhelming for you. And I like the way you put that. For something that's overwhelming for me may not be overwhelming for you, and vice versa. Whatever that is, to some extent, that's trauma, and that can affect you in the sense that a key word, hypervigilance, so that the system is always on alert. I don't sleep as much. I'm very observant. I was born and raised in the projects of Chicago, Illinois, South Side, and I'm still observant. Anywhere I go, I can see stuff. I can be having a conversation and still see what this person is doing over there, how close they're getting, or any of that kind of stuff, because those systems are still operating. When you're hyper vigilant, then that does something to your physical body, to be hyper vigilant. It does something to your health. Another symptom would be going from 0 to 50, being just getting geared up and getting escalated in a short time as a symptom. And so when you talk about experiencing the feelings and the sensations that go along with the event. The event's not happening right now. The event was 5 years ago, but you are now having something in the environment trigger you, and you're therefore experiencing those same feelings that you did when you were being attacked in a mugging on the street. All right. So it just, all of that kind of describes trauma in general, right?
Right.
So my question to you,
Mhm.
Lisa,
Come on,
is
come on.
what is different? That's trauma. Trauma is trauma is trauma.
Right.
So what's so different about
Right.
our people that we just can't have trauma? Why we got to have our own variety or version of trauma?
Right. And
What's unique about
I
us?
laugh to keep from crying sometimes when don't take my smile for I just learned to turn my frown upside down when I talk about
I understand.
But definitely know that you're right. Trauma hits every home. It does not discriminate. It doesn't discriminate on color, but trauma does look different for people of color. People of color has had trauma based off of our categories include those of racism, discrimination, and oppression, which oftentimes are not in the homes of people that are not of people of color. Okay. So you throw on top of that, not only am I being in a domestic violence, let's just do an example. I'm in a domestic violence relationship and I call the police. And I call the police because I want help. However, because I am Black and I live in an urban community, a housing project where violence is high, they may come to my home with a gun drawn and automatically. And that's how police may react. Versus if I was white and I lived out in West Omaha and I have a domestic violence call, they may come and knock on my door first before they pull their gun. So it's just an example. But we want to make sure that individuals know that people of color have racism, discrimination, and oppression in there to throw on top of those topics. And we have the lack of trust. You know, I've gone from, you know, a lot of people don't know my history, but I've gone from a prison cell to a boardroom. So I've been in executive positions. I'm in the position I am in by choice and blessings. And so I know what it's like to be at the bottom and have those discrimination things happen and occur. And I know what it feels like even now when I walk into a room and someone says, when they see that our oppression and they say we're aggressive when we're assertive and we're asking for help. Yeah. You know, it's not that people of color don't want the help. Maybe the way they ask for it may look different, and individuals have not been trained to address or acknowledge and identify those signs and symptoms that occur in African Americans, because African Americans can be depressed and have anxiety and get up and go to work every single day, and no one would know that that person is experiencing depression or anxiety. African Americans have been groomed, and even in the church, they tell us sometimes, oh, it's time to get back to work, get over it. Where, I mean, most of my experience and knowledge have been pushed by my white coworkers and colleagues to say, hey, take that FMLA. You just lost your nephew. Your mother is going through cancer. This is how you use FMLA. As African Americans about EAP and how many sessions they can get, they have no knowledge because many don't even know that exists to them. So we talk about the systematic racism that is available. And then you, again, trust in the school system. Our kids may trust their teacher, but me, the mom, if I say I'm gonna spank my child, I'm not gonna trust that a teacher is not gonna call the police on me. So there's that trust. And again, you know, when we talk about trauma, it's different. It does look different for us. I know, but I know time is of the essence, so I'm trying to.
Yeah, I know. You was on a roll. You was just like butter. You was on a roll. We look at from our standpoint, generational trauma that's passed down from generation to generation. When we look at that, that's an issue, and we don't. Again, I think when we look at these topics, we do have to really isolate them out and spend time on each area. Because when we talk about that, it's a whole different thing. So, but just in the overlay, we understand trauma, and then we understand that there's some unique things with Black and brown people that's related to that. I've been in the military, going to a military environment. Hey, that's where PTSD got started as a tag. You go over there, you do a tour of duty, you're going to be traumatized, you're going to have PTSD, you're going to come back, and we're going to give you treatment and care. And you were only over there for 6 months. If you live in an environment where there's disparities and poverty and all these other kinds of things that are extreme, there's no return of duty. You grew up there. Somebody was there. You didn't get to come back. You were there for your whole and developmental years. And whatever all that means, that's what, and it means the same thing all over the world. So you take the same type of conditions of oppression and discrimination and lack of resources and pump in drugs and guns and all that kind of stuff. The same behavior is going to occur anywhere on the planet, not just North Omaha, not just Chicago, et cetera, et cetera, et cetera. So, and folks who are growing up in these environments don't get a reprieve. You have to be there for the whole period of time, which forces you to be resilient to some extent, like you were saying, have the S on the chest and all those kinds of things. But it does some things to us physically. It does some things to us emotionally. And then there's research that says that the stress gene for us as a population has, I don't know the medical term, but mutated, for lack of better words. And it's different, and it's more hyperactive within us, therefore causing more medical problems, physical problems, psychological problems, et cetera. And so we're not only talking about generational trauma we've inherited, that's been passed down from all the stuff that we don't spend a lot of time talking about that really occurred. And we have present trauma that's going on every day with just, what everybody is experiencing, right? And then we have the anticipation that certain things are going to happen tomorrow. We fully know that at some point there's going to be these other incidents that's going to take place in our community. All of that is a bigger picture of trauma. So that's for the community. They're way in my ear saying we got to get to these last questions. So we're talking about action steps, and in the middle of us talking about action steps, they're going to come on at any given time to wrap it up, because we're coming up on a wrap it up time. So what works? The action steps that Black people must take to elevate the game when it comes to some of the things that we're talking about. What works? What's going to improve the health disparities and all of that, which I think we have addressed to some extent. But when we look at it, what policies need to change, what things need to happen. Racism has been declared a medical, physical emergency in our communities. So what can we say in terms of action steps at this point? And Mr. Sanders, feel free to intervene. But that's where we're at now, and we're talking action steps.
Yes.
Ms. Dawson. I thought you were calling on Raheem. Sorry about
Me too.
That's okay. I'm just acknowledging his presence.
You good. I'm gonna wrap it up at the end, so you guys are straight. Go ahead.
Yeah. Well, I think having the opportunity to have this kind of conversation at a systems level for me, acknowledging the racism and the inequities, but learning the more specific interventions. Like I said, access is one of the biggest, and I think that workforce does equal access. There are other things about access, but workforce is the opportunity that I have in my mind to think with all of us, what does that look like to continue to recruit, to provide people that experience? What is it about how that support, when we're talking about community and home health community purpose, What does that look like specifically in terms of making sure that we have individuals with lived experience that are Black, that are
Yes.
also leaders and
Yes.
continuing to help grow and give voice and help us cross that bridge of trust, right? I think training, all of the people that are in school right now, we just talked about workforce being short. Our training needs to be different. We need to have the training about not only disparities, but race equity and implicit
Mhm.
bias. And what does that
Yes.
do to us as
Mhm.
counselors,
Yes.
as individuals to be engaged? We have to, as a system, continue to understand the umbrella, right? So we still have work to do, although it's not all behavioral health. We know that
Mhm.
people still need a stable place to live. We
Right.
have to work together to provide that. We have to be progressive in thinking about purpose. What does that look like in terms of education and employment? We cannot have children that are Black in a classroom that act out for their experienced trauma, some incident that they saw in their neighborhood, and they're act out and they're viewed as aggressive
Yes.
and perhaps not referred to treatment. So we have to continue to train and really recognize that. I have a whole list and I know we're short of time.
I do like what you started with though, when you said access. And the access being in schools, being in churches, being in the community centers, being in our communities, and utilizing people who are not necessarily licensed, but have lived experience that can supplement the licensed people that we rule out, but we need to include them in. Just for instance, Mr. Sanders, I don't see any LMHPs or any other kind of mental health digits behind his name, but he clearly has a grasp of the
What's
issues
going on?
as he articulated there. So that just goes to say that there are other people that can do that too. So that I would anchor what you said with access, but you gave some very beautiful other ideas. Elisa.
Yep. So I'm not going to repeat the ones she talked about. I'm going to talk about the workforce and the pay. It's just giving knowledge that therapists in Omaha, Nebraska, and in Nebraska period, we get paid less than teachers. So the pay to pay for entry level roles and to do this work is, it's just not, it's almost, but along with barely livable wages for some. So that part makes it hard for individuals to want, even if we get in these career fields or they get in these career fields, to want to work and be able to afford to stay in the career field and have a family. The other thing is to technology systems. It's so many loops and hurdles to be able to even see someone to get paid for the services you do. And find out what the last therapist did so that you're not working twice as hard to find out and diagnose somebody that was diagnosed as 3 therapists before you, and they just happened to come to you because I was the only one to be able to be available because no one else was available. There is loopholes in our technology systems for therapists to be able to communicate, or individuals in the field of, not even therapists, but in the field of mental health. There is loopholes in our technology and our communication highway that makes it difficult for us to be as productive as we should be. So that part is one of my key things that I always want to push.
Now, see, you added something that I hadn't highlighted before in my understanding: money and the pay and the training that goes along with that. That is significant. That is major. And that is necessary in the field in regards to the training that's necessary. And I think also the whole thing that both of you said in regards to people being knowledgeable about the issues. So whether we're calling it now cultural humility, we've called it before cultural relevancy, folks need to know what's going on when they are in a position to speak into the lives of children with these issues. So that's a good way to wrap it and bring it into our foundational host, Mr. Sanders.
Hi, what's going on, good people? So I really appreciate all of the dialogue tonight. I'm not even gonna lie to you, this is some really deep stuff. But we got really 2 good questions from the audience that I've been waiting to bring up and mention and get some feedback from you guys.
Yeah.
But before I mention the questions, because they're revolved around these issues, I want to just bring a little bit more facts and, in terms of Black trauma, because that was
You
mentioned
bringing
a
some
lot
more
tonight.
facts?
Come on,
Some
yeah.
more facts, but it's going to be brief. It's going to
Bring
be
it.
brief. So people were talking a lot about Black trauma, and I want you to, remember, one, if we look at Midwest, Omaha, Nebraska's in the Midwest, Nebraska's in the Midwest, there's a lot of states in the Midwest. It's a year from George Floyd. George Floyd killing, murder was in the Midwest. But just think about the history of the Midwest. We talk about Chicago Red Summer 1919. We talk about Detroit 67. We're talking about, all types of the red lining across the Rust Belt.
Oh.
We're talking about the murder of Tamir Rice. We're talking about, all of these things that has been going on in the Midwest. And even before that, we're talking about, you mentioned slavery. There was a lot of topics. So just in terms of slavery, and not related, but kind of the racial terror related to lynchings, because terror, like you mentioned, is a part of, the trauma that we get from mental health. And just in the Midwest alone, Kansas has 18 reported lynchings, Missouri has 60, Illinois has 56, Indiana has 18, South Dakota has 1, Nebraska have 5, and these are all reported. These are not the ones that people took the postcards and the pictures and didn't report. These are the ones that people, we did this and this is what we did. Oh, that goes back to the questions. So with that knowledge in mind, the first question is, all right, so in line with those incidents, question is, we mentioned George Floyd, an attack on the Capitol.
Mm-hmm.
What about something closer to home? Because out of all these things, we didn't talk about something close to home. In 1919, September 28, Will Brown was lynched in front of Omaha, Nebraska's courthouse. This bullet hole still in the courthouse to show it. Talk a little bit something closer to home. What is the impact on Black violence and the impact on the Black environment in terms of the mental health, not only that we've experienced from the trauma, but what we're experiencing right now?
We could even just talk about this past year. It's coming on a year of the murder of James Scurlock. May he rest in peace. And that happened in Omaha during that time of the protesting, and how that affected our Black community, especially our young African-American men in the community. And to see that never had a true resolution because of the way that it ended. But that impacted our community. Did they handle it in a way to keep it like, but that impacted our community. It impacted the way, and that's traumatic to some of our African-American young men to know that happened downtown where they hang out, one of their places where they have the ability to hang out. And now they have to fear that if they're down there in the old market, that they could be murdered by a white man and he get away with it. So when we talk about the things that's going on in our community, in our African Americans, that's one that sticks out for me. That's still current. As a mother of 3 sons, I'm like, no, don't go downtown. It's traumatic to me. It makes me be more vigilant. We talk about even just shootings by our police officers of our African Americans. We've had more African American men that were shot by police in Omaha, Nebraska, than white American men that were shot by police in Omaha, Nebraska. So the trauma is here and it's still forefront. But having those hard conversations in providing safe environments for that, and that's where those support groups come available. We have Black Men Step In. We got I don't know. I'm sure people probably get tired of me sending them over to Charles Jordan. It just hurt my feelings, Mr. Duncan, when you said me and well, be a couple of quiet. I'm like, oh man, I'll be sending because it's just not enough, African American men that are in this field, and I would love to see some more. I mean, I could go on. Let me stop because I know you say time is of the essence.
let me. That's I think you're right on point with that. I would say it real simply. the challenge that we have, and this is a mental health issue, the challenge that we have is the constant message to us from issues like this is we as a people are less than. We are less than. And so it is a mental health struggle to constantly have to fight that message through incidents, through events, through images, to have, again, you have we sent our best to Washington, best family, Obama and his wife and his two lovely children, but his wife was portrayed as a gorilla. And he was called a liar in the middle of his State of the Union address. So, I mean, he didn't have his pants sagging. He didn't have, it was so the message, the consistent message with these type of incidents is that you are less than, you are outside the pale of humanity. That is a mental health, I can't even put it to describe what that does to somebody's mind.
Yeah.
That to look at yourself and to somehow at some point people have to resist the fact you can't accept that message, because if you accept that message, you look at yourself as less than, you're going to treat yourself and other people who look like you as less than if you receive that message. So from that standpoint, it's another blow, it's another punch, it's another psychological, spiritual punch to us that we have to absorb. Incidents like the one that you're talking about, that we have to refute the big lie that white is superior and black is inferior. It becomes another thing that we have to resist in our own psychology, just to see ourselves as a part of the humanity of the world. So
So I got another question. I'm not mean to cut you guys off, but I do want to get Ms. Dawson's feedback on that previous question before I go on to the next one. So do you have anything to mention on that? The previous question?
I was just going to piggyback a little bit on what Larry talked about. And I would say, as I went through trauma, as it was described to me by a wonderful Dr. Vivian Jackson from Georgetown, as we did our system of care. And one of my takeaways from there is, I think how she couched that was voice and value, that voice and value is a continued with historical trauma, with racism, judging, that is just another thing that individuals of color experience. In this case, we're talking about African Americans, in addition to all of the other experiences just on the day-to-day basis. And so again, when we've talked about trauma, I just think it's so key for us to think about that in really some layers based on people's experience, because it is different. I honestly have to say that was a learning moment for me. And that's probably been about 12 years ago.
Wow.
Mm-hmm.
You're muted.
Come on, Raheem, turn that mic on.
All right. So I got one last question, and it's a real good one. But it's unfortunate because we got to wrap up soon. I'm getting some feedback in my ear too. My ear is buzzing, but real good question. So the question is, can you elaborate more on the mistrust issues within the school systems that African Americans have? And along with that elaborations, how does this create a barrier within how not only the children, but the parents, and how the parents facilitate the children to seek therapy within the school system?
Very deep.
That's a loaded question. Man, they
Very
get to
deep. I'll just jump right in and say something and make it real quick. the mistrust is in general. The institutions as a people, we don't trust. And
Right.
so in respect to the school system, we don't have control over our schools. So we can't say what happens there, what's taught there, what goes on there. We can send our kids there, public schools, but we really can't say a whole lot about what goes on there, even if we join the PTA. This is what the curriculum is. It's going to take an act of Congress for something else to happen in this school other than what's written on these tablets here that we are providing in the school. So in general, we get around and deal with the mistrust, distrust issue by word of mouth. Same thing that we've done as a culture from age on in. One person says, hey, go see Elisa. So that person can navigate through all of whatever else is being given and end up in her care because word of mouth said she is to be trusted. And that's because of who she is, not necessarily just because she's Black. She is Black, but it's going to be about the care that she's given, that somebody has developed a sense of trust. So for us in our community to navigate through all these systems and institutions that don't give us a lot of choice, a lot of it comes down to, I know that person, I heard about that person got an endorsement from somebody that I trust. I'll bypass everything to get to that person. And sometimes the system, and we've seen this, I know you've seen it, Lisa, the system will say, you can't go see the person you want to go see.
Right.
They got the credentials, they're in the field, but we're gonna tell you who you're gonna go see, and it ain't gonna be the person that you want to go. Now that is a little interesting.
Yeah. And I just want to put on top of that, the stigma that in Black African American homes is still there. What goes in our home stays in our home. And so that trust of individuals when they receive that information in schools, and they make those emergency calls without, sometimes some is very relevant. Yep, I see bruises on the kid. Go ahead, make that call. Don't stop. Make the call. You have a duty to warn. But if my kid come home and they say, "Oh, I seen a bullet go through my wall," but what goes on in my home stays in my home. So there's some information that they may not share to give you a full story, and that's where that trust come in, where teachers and communication with parents. And sometimes you need to do more than just that 1 or 2 calls. Do that 3 or 4 call to build those relationships. And don't call me when little Johnny is just getting in trouble when he being loud and disrupting your class and flipping desks. Call me more often. Building those trusting relationships is going to be important. And we did talk about it, that the kids spend it at school as much time as they do, if not more, than at home prior to COVID. And so we have to know that relationship has to be built. You can't build a trusting relationship with my kid and not trust me.
That's true.
As a parent.
Yeah,
it's true.
I think that was a really good point as I think about especially things in school or just in general. When we have mental health, it impacts the family, and especially with young people. And so that is important. So I guess, Raheem, I was, hopeful about this forum, and it's been a great learning experience for me, and I certainly want to learn. So embracing hope that we're going to identify solutions and that there's an expectation of change. I think for me, one of the fundamental opportunities is to really learn more about what does that look like in terms of continuing to build those strategies for trust, because bottom line, that is huge in life. It's all about relationships, but specifically in mental health. So that might be another forum, or I'll come and talk with y'all and figure out who should be at the table. But I'm just, from my perspective at the system level, for me, those strategies are key, because that is the basis of expecting change.
Awesome. Well, we have answered your questions, and the main hosts are going to be coming back up. And until, yes, here he is.
Hey, you guys, oh my God, the dialogue has just been so on point. And thank you, our guest host, Larry Duncan. Thank you so much for your insight and just really navigating this evening. And to both our panelists, just point on, and our contributor, Raheem, I want to call him the good Dr. Heem. I want to thank him as well. You're the subject matter, the issues, this whole thing of trust, and I want to leave you with, some of my thoughts in terms of trust. The 100 Black men, they have this old saying, it says, "What they see is what they'll be." How we're going to increase our trust, we must be very intentional and deliberate about putting more people that look like our children in front of them. Period. I'm not saying it's the total answer, but I think is along that path of solving that problem. And when you think about all the things that we talked about tonight, it is heavy. I mean, Larry, you talked about this whole thing of just feeling less than a human and how people make you feel. But, the bright side is this, we're still here. In spite of the 400 years of the pain and the pressure. And when you talk about, you couple all that in terms of the mental, and we are still here and we still smiling for the most part, man, that tells you in terms of resiliency and who we are as a people. And so I think the challenge is, you don't feel that you're by yourself in the feelings that have been talked about tonight. There is opportunities out there to get help.
Yeah.
And I think we owe it to ourselves with all of the stuff that we've been carrying on our back. Please take the time to go get help. And don't feel that, the stigma, oh, hey, I'm crazy, or if I go, I was talking to someone about, I need a therapist, and I need one for a lot of reasons.
Oh, yeah.
I think we all should have, just like we have a medical home, a medical family doctor. I think everyone, I want to challenge everybody, go find a therapist that you can hang out with, right?
Right. I'm a therapist with a therapist. I'm with you, Tim.
You see what I'm talking about. See what I'm talking about. So, and then the last thing I want to say is we got to take the time to breathe. And that's taking deep breaths, because it's so important to just breathe and let it in and exhale and let it out. And so with that, I just want to thank you guys for tonight. Thank all of our sponsors. This has been awesome. And please share this. Go like our page, Moving People to Action. This is a movement. The people are rising. It's time for a change. And that change will not happen unless we look ourselves in the mirror and become that change that we desire. I'm out. Rain. Thank you, guys.
Good night.